right, it is now February 6, 2024. Welcome to our live stream from Deuk Spine Institute. This is our last surgery for the day. Our patient comes to us from Texas, and he has back pain coming from several areas. One of them is the L5-S1 disc. He's got a pinched nerve, which is causing left leg pain as well. But he also has some other issues we're going to address at a later date. Today our focus is the L5-S1 left side herniation, pinched nerve, and the pain coming from the L5-S1 disc. All right, how are we on orbit? Looks like we're off a little on orbit. Would you agree? There's a little scoliosis at 5-1. That's it. That's an improvement. I think you need to do a little more. Not much. Shot? All right, we're just, right? Whew. I never knew that tendonitis could be so painful. Well, I didn't feel a tear like at the time, but AP. As we get older, I guess our ligaments and tendons get weaker as biceps. Oh, yeah. Like if you push, it hurts, huh? Patel said tendonitis. I don't know. But it spasms. Okay. Let's, Henry, let's show the audience why do these herniated discs, that's nice, Jordan, why do they cause so much pain for patients that have them? All right, well, while you guys were watching that nice video explaining how discs cause back pain, we tested this disc shot at L5-S1 to see if it was causing his pain, and he wiggled his whole body when I injected, and he said, we said, how much did that hurt? He said, that's a 12 out of 10, 12. And I said, is that where you get your pain every day? And he said, yes. So we definitely found one of his back pain sources. It's the annular tear at L5-S1 on the left side, and we're going to go in there and fix that. That also happens to be right where his nerve is being pinched. So he comes to us from Houston, Texas, and he has watched several of our surgeries now online. He's here with his lovely wife and he's going to sleep now as we speak. We're going to get this dilator into the disc and then and then we're going to get on with the surgery. Thank you, Luis. Am I okay here, Dr. B? Yeah, no worries. A little wiggly wiggly. I'll just wait a second. All right, so right now we're going into the most painful part of his disc hurt injury. It's the annular tear. And he doesn't like it, and that's why we have to put him to sleep. So he's going to be asleep, and that way we can go in and repair this painful tear. Let me know when you think I can proceed. Yeah?
Yes.
All right. That should be it. You feel it go? You see that? Yeah. You see how that resistance went, Luis? Uh-huh. Go ahead. All right. So, Henry, let's show the audience how this surgery actually helps patients get out of pain. Okay, you could see from that video that what we're doing here with the Deuk laser disc repair is arthroscopically going into the tear that the herniation came out of. We're cleaning that tear up so that the body will be able to heal it naturally. This is a natural surgery. We're not putting anything artificial into the body. Everything we use is natural and naturally found in the body, with the exception of the blue dye, which is made by a plant out in India. It was the same dye that was used by the British royalty and Chinese royalty over years. European royalty. It's indigo carmine dye, and it creates this royal blue color. It sticks to the herniation, and it doesn't stick to anything but the herniation. By the way, look at the dark spots on the tube right there. You see those? Those little circles? Those are where the laser hit the steel and melted it. That's melted steel. Now, some people want to know, can the laser get rid of bone spurs? Absolutely. Can it get rid of metal? Absolutely. We use lasers these days industrially to cut steel. Not at Deuk Spine, obviously, but in factories that manufacture steel parts, lasers are used to cut steel. So lasers can be very powerful, and our laser fiber is there at the bottom. You can see it. It's quite literally 1 millimeter wide, and I've got 8 minutes left, Dr. Berndes. 8 minutes. All right, any questions from our audience, Henry?
Yes, we have 2 questions so far. This first one comes from
Robert.
Dale on Facebook.
Hi, Dale.
They ask, is this treatment available in Australia?
Dale, this treatment is not available in Australia. You're watching the pioneer who pioneered this treatment in the United States, right here in Florida. Melbourne, Florida, not Melbourne, Australia. You're going to need to come here to get it. It is the best treatment you could possibly get. They don't have anything this good in Australia. And honestly, other countries too, so don't feel bad. I like Australia. I'm not dissing Australia by any means. but we have had Australians come here before and get surgery. As a matter of fact, we have people from all over the world that come to Deuk Spine for surgery. See that right there, the blue? That is the tear and the herniation stuck in there. That blue is why the disc cannot heal itself. If that herniation wasn't there, this patient would be able to heal his own disc, and he wouldn't have pain in his back or leg. The problem is, once the nuclear material gets stuck in the annular tear, you cannot heal your own disc. We call that a disc bulge or herniation. And once you get to that stage, past the tear to where the jelly is coming out, then there's no way. Look, there's a piece right there. You guys see that? Just wiggled itself out. That's a herniation. That's what I'm talking about. That's what's stuck inside, thank you, Luis, inside the tear. You see it down there?
Yes, we do.
And as long as those pieces are there, the tear will never seal, never heal. Got probably 5 minutes left. That's a scarred one too. You could tell. It's got that calcium on it. But yeah, this surgery is not available anywhere else in the world but Florida. It was developed here from arthroscopic techniques, where we started using the laser, made it better, and this is the best you could possibly get anywhere. Deuk Spine Institute is capable of doing all types of spine surgery. As a matter of fact, we have a fusion coming up in a few, the end of the month. A patient is coming here to have a lumbar fusion. Single level. Don't. Out of state. Yeah. Grab her. Thank you. We don't do a lot of fusions anymore. She's not a DLDR candidate, yeah. Unfortunately not. I don't really enjoy doing fusions anymore, but I do them because we do a damn good fusion, better than other doctors. So she wants me to do it, and I'm going to do it because she needs it. It's the right treatment for her. You've done a few fusions with me, right, Berndes? And 5 or 6. Yeah. In 2 years. Uh-huh.
We have a couple more questions.
We don't get too many. Yes.
This next one comes from JMC on YouTube.
All right.
They asked, does posterior foraminotomy in the neck have to do a fusion?
No, posterior foraminotomy in the neck does not have to do a fusion, but it's a horrible surgery that doesn't really work. There's doctors that do it, and you're eventually going to need a fusion if you get it done because they don't work. I've done many of them in my career. I know how to do them. I could do them very easily, but I never recommend that procedure because it doesn't work. There's much better surgeries available than a posterior cervical foraminotomy.
This next question.
I would just say the doctors that do posterior cervical foraminotomy, in my opinion, okay? So take this with a grain of salt. It's just my opinion. They are not very good spine surgeons. They're choosing a surgery that is a very old type of surgery that doesn't work well. And to me, you offer that to your patient when you can't do the newer, more advanced surgery. Oh, that piece of herniation is driving me freaking crazy. So, just so everybody understands, not every spine surgeon can do every spine surgery. Okay? The best spine surgeons can do every surgery. That's the best trained, the best surgeons. At Deuk Spine, we have that. But a lot of spine surgeons can only do a few procedures. They're only comfortable doing a few, they're only trained to do a few, and posterior cervical frame is one of those procedures that, in my opinion, is an old surgery that shouldn't be done anymore unless you're doing it with a fusion, a posterior cervical fusion. For example, I will do a cervical laminectomy and fusion, and I'll do a foraminotomy with the laminectomy because I want to decompress the neuroforamen. But as long as you're just doing the foraminotomy, you don't get a very good result. If you do the laminectomy with the foraminotomy and you go wide, then you're going to get a good result. The problem, though, is that then you're destabilizing the spine. And when you destabilize the spine, you need to do a fusion. Almost done. You're doing great. Another 3 minutes. We're in that worst part of your disc where all the pain comes from. You're doing awesome. Patient is waking up. We're not gonna put him too deep because we're just about finished here.
We have another question.
Yes.
This comes from Chasen After Jason on YouTube.
Jason after Jason, good to have you back.
They said, thank you for sharing this work live. I know the surgery clears the pain in the area. Is it likely to remove the numb feeling I'm having in the bottom of my feet as well?
Yes. The reason why you're having numb in the bottom of your feet, Jason, if it's coming from your back, is you have a pinched nerve. That nerve is right here next to where we're operating. And that nerve is getting crushed by this right here, this herniation. So when I remove the herniation and get the pressure off the nerve will heal. And it takes about 6 months to a year for the nerve to totally heal and the feeling to come back. Most people don't get the feeling back right away. It literally takes 6 months to a year. But the only way you're going to get the feeling back in your leg is by having the surgery done. So you need this surgery to get your feeling back, but it won't come back right away. I tell everyone to wait a year. All right, we got 1 minute left and we should be done. This is the end of the disc. This is the worst part. You can see all the blood vessels there from all the inflammation. He's got some fat there as well. Fat's there because inflammation takes a lot of energy, folks. It needs energy, and fat is energy. So many pieces I have to go chase. That should just about do it. I'm going to try to show you guys the nerve in just a second. The nerve that's being pinched that causes the leg symptom. It's just here to my left. Give me a second, I'll show it to you. This laser just doesn't seem very effective. Luis? I don't know. I mean, it's eventually getting it done, but it seems like I'm having to spend a little more time than normal. I got drippy on my right hand. I feel it on my feet. All right.
We have another question.
So yeah, scope use is going to be a 6, even though it's one level. I'll take the question.
This comes from Liliana on YouTube.
Hello, Liliana.
They asked, if a patient needs a piriformis release, is that due to a herniated disc?
No.
And would a patient need to do both to feel relief? Thank you for doing these live videos.
Yeah, Ileana, the piriformis syndrome is totally separate. Has nothing to do with the disc herniation directly. However, if you have a disc herniation and it hurts to move your body normally, then you don't bend normally and you can injure your piriformis muscle because your body mechanics have shifted. So instead of bending properly with your legs bent, you keep your legs straight, you bend to the side, and then that tears the muscle. And now you have a piriformis syndrome. See what I mean, Luis? It's like non-stop dancing. See what I mean? See what I mean?
I see what you're saying.
It's just not. Normally it would just destroy this thing in seconds. It's just fragmenting and it's not really breaking it up, huh?
Has to be the laser fibers.
That's what I'm thinking,
Yeah.
right?
Oh yeah.
Let go.
Good. Give it a little more side this time.
Hmm?
And this time they will give me more.
No, it's the laser is not burning the disc as it's supposed to, so it's taking longer. I mean, if it was working, if it was burning like normal, then we'd be done by now, but I'm having to take extra time because
Setting right on it?
it's not the setting. It's just the way the tip is shaped, probably. Yeah. I mean, all right, should be done. Are you doing Gypsy Kings this year?
I don't know when he's coming back.
Friday.
But
Friday.
This Friday?
Yeah.
No.
I just found out my wife got me tickets.
Nice. Same place?
No, I don't know where it is. It's somewhere else in Orlando. I don't think it's the same place. I don't remember where she said it was. All right. All right, I'll show you the nerve. The nerve's right there. You guys see it, the white thing?
Yes, we
That is
do.
the nerve. So we were operating just below it. That's where the herniation was coming out, pushing on the nerve.
Sitting on, please. Thank you.
So we got the nerve decompressed. We cleaned out the tear. Everything went very well. He did great. Any questions?
No current questions.
All right, let's go ahead and end our stream. Thanks for joining us. It's been 3 very good surgeries, cervical, thoracic, lumbar. Finishing off with the lumbar as our last case. Our thoracic patient's doing very well. Cervical patient has already gone home. And this patient will do fantastic. I got it. You can go ahead and end the broadcast.